Hi, my name is Jill Messinger. I'm a nurse with Horizon Healthcare Services, and today we're going to discuss the CADD Solis pump. The CADD Solis pump is the next generation to the CADD Prism pump. So if you are familiar with working with the CADD Prism pump, this CADD Solis pump should come pretty easy to you. They did a lot of nice upgrades from the Prism to make the Solis pump. So you should really like the Solis pump if you've worked with the CADD Prism pump. We are, right now with Horizon Healthcare Services, we are providing the CADD Solis pump to patients who are on TPN therapy. So patients who have been on TPN therapy in the past, we're going to phase out those CADD Prism pumps with the Solis pump. So some of you working with our agencies, we may have to do teaching visits just to get the patients up to par with the CADD Solis pump. Then as new TPN patients come on service with us, we will be sending out the CADD Solis pump for them to use. So today we're going to go over the basics of the pump. I'm going to talk about an initial delivery, what you get with your supplies, and then just the basic setup in a TPN mode for a patient who's on TPN therapy. So just to go over the basics, if you are the nurse going in the home and you are helping the patient set up their TPN, and with any initial visit with a patient who is a Horizon patient, the first thing you always want to do is grab your white teaching folder. So your white teaching folder will have your instruction sheets in there that you just want to pull out, review yourself if you need a refresher on any of the therapies. The instruction sheets are made for the patients to use, for them to follow, to do their medications. So always teach off those instruction sheets, because when you're not there the next time, we want those patients to be following those to do their therapy. First thing they're going to see with their CADD Solis pump, though, we send out this nice picture diagram just stating that the patient's receiving their CADD pump. They're going to receive a power charger here, a power cord to charge their battery, which we'll review. And they're also going to receive the battery pack, which will be the power source for the pump. Also, with their delivery, they're going to receive 4 AA batteries. These are to act as a backup, especially with the TPN therapy. We want them using the rechargeable battery. The AAA is just to use as a backup. If they're having problems with their battery before we can get a new one out, or if they just need a backup source of power, they're to use those AAA batteries. They should always have them in the home, though. So if they use them, we would like to get a new set out just so that they have a backup source. Other things in their delivery, they're going to have a backpack. This is a small backpack. If it's a TPN therapy, it's going to be the large backpack that they can actually put on their back. They're also going to receive their tubing set, which will be what we connect here to the CADD Solis pump. They're going to replace that tubing once every day, every bag of TPN. They're going to want to put a new tubing set on. So with that, once you kind of review all the supplies in the delivery, you would pull them out with the patient, and then what we would do is we're going to talk about the pump. So just so you guys know, just some basics of the pump. We're just going to look at the pump here. If you're familiar with the CADD Prism pump, this pump should look a little similar to that, just a upgrade, nicer design, smart pump that they've designed. So first thing is that we'll talk about the battery. So the battery here, this would be your battery for the pump. You can either charge the battery itself, so you can hook up little port here that you can hook up and charge that battery separate. The battery should come out to the patient on initial delivery fully charged. How we would want them to charge it, though, is that they can put this battery in. The battery is going to fit just like a puzzle piece, that they can slide this in. It should only fit one way. If you had to do the AA batteries, you're going to see on the inside, they have the picture for you to put in the AA batteries. So once the battery's in, you're going to push it all the way down. You'll have a little tab that you can pop that battery back out to grab, and then you're going to push the door closed and then turn it to lock it into place, and your battery's in. Other functions of the design or the anatomy of the pump that you see here, you're going to have a power button right here. This is your lock that you would use in the PCA mode. You don't need to use it in a TPN mode. And this, you would need the PCA CADD key. If you had a CADD Prism key for the TPA, they did redesign that key a few years ago. So if you have a really, really old key, it's not going to work. But if you have the newer one within the last couple of years, it looks the same. It's a little flatter, but you can use that here with the CADD Solis pump. Other thing is going to be your cassette latch. So this this arm here is actually your cassette latch, which is going to latch your cassette on. If you're looking at the face of the pump here, you're going to see some similar buttons to the CADD Prism pump. So we're going to go ahead, we're going to turn the pump on. Oh, sorry, we're going to talk first before I move on. We're going to talk here first about the power port. So like I said, you can charge the port either to the battery, or you can charge the port, you can charge the battery through the pump. So you would plug it into the top. It's just going to push right in there. And if you had the pump on, it would tell you that it's charging there. You'd see a little picture on the top there that the battery is charging. It's just important to review with your patients how to disconnect this cord. What we're finding initially was that patients were just pulling this cord, and we can break this cord easily by just pulling it. Patients actually want to grab, there's a little textured part to this cord. You can see it pretty good there, I think, in the picture here. So, but patients want to grab from this little textured area. They're going to grab and they're going to pull that initially. So it's almost a little spring-loaded area on the cord. So they're going to grab that initially, pull back, and then pull out. We don't want patients just pulling out. They really have to grab here, pull out first, and then pull the whole cord out. So you can kind of see, I'll just show you that again. It's it's like spring loaded. So they're going to pull first and then pull out. It just acts to release the little grips on that cord. So they would charge that if it is a patient who's doing nocturnal TPN. What we would do is we would have the patient charge that battery during the day. So when they disconnect in the morning, then they would plug in their pump to the cord here, and they would charge that the whole day to get a full battery. Then they'd have a full battery to run into the night, and it should get them through that nightly bag of their TPN. So once again, they don't have to remove the battery at all. So then when you're looking at the pump, we're going to go ahead and we're going to turn it on here. So if you remember the Prism pump that had the battery door that you had to drop the 9-volt in, this is nice because it just has the power button. So just similar to the Prism, if you're familiar with it, it's going to charge up, going to do its initial test settings, and you're going to get that special sound, similar to the Prism pump if you are familiar with the Prism. So we're just going to look at the screen here. So a couple things on the screen. To this top corner, you see the battery. It says green right now. Mine's a little bit depleted, but it's still green. So that means it's good to go. You will see it'll go from green to yellow to red. So it will still function and run in the yellow. When you get to the red, it means that yes, you better get this pump plugged in to recharge that battery. So it's a nice visual for the patients that they know. Right now we just see, similar to the CADD Prism pump, the screen just went blank just to save on the battery life. To bring that up, you're going to see it says select. It's kind of like your next button. So we're going to hit select. It's going to bring it back up. You're going to see, similar to the CADD, that we are stopped right now. And then you're going to see your res volume in this top corner. So other things that you're going to look at, you see this little shape designed here. This is called the taper mode of the Solis pump. The CADD Prism, it was called the TPN mode, but we call it the taper mode here using the Solis. So what that means, if you look at the design, you're going to see that it's going to taper up initially, it's going to plateau during the infusion, and then it's going to taper down. Then you see that nice straight line, and that's signifying that it would kick into a KVO mode with that. So when, if you start using this pump in the intermittent or the other settings, you're going to see that screen has a little different shape. And as it infuses, you're going to see that starts to light up so you know what phase you are in of your infusion. So right now, we're going to look at the other buttons on the pump. We see that there's a program button and a tasks. So the program, obviously, if you hit the program button, you can verify how the pharmacist has it programmed. So at this point with my patient, I would have my order. I would have my label, which would be my TPN bag label. You can also have a label, the pump. The pharmacy usually sends the pump out in a bag that also has a label. So I would be verifying with my orders, my volume, if I would taper up, and then I would be verifying those settings on my program screen when I'm looking at it. So when you're looking at this, you're seeing that it has a total infusion volume. So that's how much the patient's ordered to get. And then you're going to see there is a taper up and a taper down. So I'm trying to get it so that you guys can see the screen. There's a taper up, a taper down, and then there is the total infusion duration. So for this patient, they were ordered a 12-hour duration. So when we want to see more, you're going to see there's a little arrow on the bottom of the pump. So then we would use those arrows to scroll down. So then you're going to see the plateau rate. You're going to see that it's a KVO rate of 5 ml. So that means at the end of that infusion period, at the end of the 12 hours, when it would have completed the taper down, it's going to kick into a KVO. Then you're going to see on the bottom, it's a res volume. I obviously use this pump. Otherwise, the res volume should be your total volume in that bag. So in this case, it should say 1250, but I had primed this once before. So, but it should say 1250 or whatever your infusion, your total res volume is. And yet you would verify that on the bag label. So there'll be a total infusion volume, and then there'll be a res volume stating what's in your actual bag. You have a little bit of overfill in there. It accounts for the priming volume, and then a little bit for that KVO volume that we talked about. So at this point, I'm going to go back. I would have verified my settings. All right, so we'll just talk through hooking on the administration set. In this case with the TPN, we use the high volume administration set. There is just our regular tubing volume administration set. It doesn't take as much volume. In this case, we have the high volume administration set, and it does have the micron filter on there. So when you're opening up a new tubing set, you would be removing the tubing. It has this little blue clip on there. We instruct our patients to remove that clip prior to hooking up their med administration set to the pump. In this phase, if you were instructing the patient how to administer their TPN, I would, instead of focusing on the pump, be instructing the patient on how to do additives to the TPN bag. If you guys need help with that, certainly call into Horizon. I'm assuming most nurses right now would know that you're going to be adding some additives to that TPN bag prior to setting up for administration. So we're going to say that that part was done if we added our multivitamins or whatever other additives were ordered to that bag. And now we're ready to get our tubing set and prime at this point. So, and once again, if you're the nurse in the home, you really want to be using these instruction sheets. So I'm kind of giving you an overview, but if you are that nurse in the home, go step by step with these instruction sheets, just so that so that the patient doesn't miss a step. So then that way that when you're not there, they can be following these instructions step by step the first time they're doing it by themselves. So once we would have had our TPN bag set and ready to go, I'd be getting my administration set and I'd be connecting. So just very similar to the CADD Prism, you're going to hook. I always say it's like a door. So if you haven't used it before, they're like hinges. So I always say you're going to hinge it like a door. And then just like the key, you didn't have the key before, this has the latch. So you're going to pull that latch down. I'm going to push it down on a hard, firm surface. I'm going to push down and latch back up, and my tubing is latched. So you're just using that latch to connect the administration set. Right now, I'm setting it up here. So it's going to ask me, do I want to prime my tubing? So that's nice because when you put a new administration set on, it's going to just prompt you, do you want to prime your tubing? So one nice function of the Solis pump compared to the Prism pump is that when you do prime, you don't have to hold. So if you are used to the Prism pump where you had to hold your finger on the yes button, this is nice because it has an auto prime. So at this point, I would hit yes. It's going to tell me, do I want to disconnect from my patient? I'm already disconnected. At this point, I would have spiked, so I would have uncoiled my tubing here. I would have pulled my plunger from my TPN bag. I would have pushed up my spike into the bag firmly, make sure it's connected, and then I would prime. So it's just telling me disconnect from the patient. I'm going to prime. Nice thing here is that it doesn't auto prime. So other thing that you're going to look for, though, priming, it's very important. It has a little picture here, and it's telling you, turn the pump with latch facing down. So if the patient is looking at the pump, they're just going to turn it in that direction. So you're going to see that if you have your TPN connected, try and show you here, if you have your TPN connected to the spike, it's pulling in the TPN so that the air is going to come out first. So to filter any air out, just to get all those tiny little air bubbles out, it has you turn and there's a picture. So that's just another important piece that you want the patient to take note as they're doing it. Other new thing that they have upgraded this tubing, the high administration set tubing. If you see, it's a smaller filter. The filter also sits down a little lower on the tubing set, but it is smaller. You're going to look, it has an air direction. So it has a flow direction. So once my TPN gets to the filter, I hold it upright just to let all those air bubbles get out. If you don't, you're just going to see a little bit more air bubbles if you don't have patients do that. But it does have a little arrow to prompt you on what direction the fluid is going to flow. And if you hold it, it'll just get those air bubbles out a little bit faster than you would see. So this does an auto prime of 20 mLs. So this high volume administration set, it's a total volume of 17 mLs. So you can either wait to 17 mLs, or if you're not going to wait and you're going to let it auto prime to 20, you just want to make sure that you have your end over a trash can or in some type of container to catch anything that leaks. So at this point, I'm going to wait till 17 mLs. Once I know I'm at 17 mLs and I have fluid to my end cap, I see that I have all my air bubbles out, that there's no air bubbles left, and obviously I would be holding it to the side like my picture demonstrates here. But once I'm at that volume, I'm going to hit stop priming. So this one primed a total volume of 18.2. Continue priming. No, I don't want to continue priming. Now it's going to prompt me, do I want to start my pump? So at this point, I would be then preparing my patient's line. So either scrubbing that PICC line or whatever type of central line you do have, scrubbing the hub for a minimum of 15 seconds, giving an air time to dry, and then you'd be hooking up your end cap to the TPN. Once I know I'm hooked up, then you're going to start the pump. So you're going to see, do you want to start the pump? It's going to say yes or no. So yes, I want to start the pump. Well, it's going to give me an error message because I don't have anything in there. It's not sensing that I have any fluid. So I'm just going to go back because it's not going to flow for me. At this point, though, it should start the pump for you when you start your infusion. Very similar to the CADD pump, it will give you a high frequency alarm. It will give you a low battery alarm. I go over those most frequent alarms with my patients when they're starting on service. So it's easy just to clamp the line when the infusion's starting, just so that patient can hear that high pressure alarm, review with them to check their tubing if they know it's clamped. And that would be an initial setup with the TPN with the CADD Solis pump. And just a review of the CADD Solis pump. If you have any questions with this pump, we do want you to call us. We're available to you 24 hours a day.